Question 1. A postpartum client delivered a 4.2 kilogram infant via vaginal delivery 30 minutes ago. The nurse notes continuous heavy vaginal bleeding and a boggy uterine fundus displaced to the right side of the abdomen. Which nursing action should be performed first? A. Administer oxytocin infusion as prescribed. B. Assist the client to empty her bladder. C. Perform vigorous fundal massage. D. Prepare to administer methyl-ergonovine. Answer. B. Assist the client to empty her bladder. Rationale. A distended bladder can displace the uterus and prevent effective uterine contraction, leading to uterine atony and hemorrhage. Emptying the bladder allows the uterus to contract effectively and reduces bleeding. Question 2. A nurse is caring for a client 1 hour after a vaginal delivery who begins saturating a perineal pad every 10 minutes. The uterus is firm and midline. Which condition should the nurse suspect as the most likely cause of the hemorrhage? A. Uterine atony. B. Cervical or vaginal laceration. C. Retained placental fragments. D. Inversion of the uterus. Answer. B. Cervical or vaginal laceration. Rationale. If bleeding occurs while the uterus remains firm, the likely cause is trauma, such as cervical or vaginal lacerations, rather than uterine atony. Question 3. A client with postpartum hemorrhage receives methyl-ergonovine. Which assessment finding requires the nurse to withhold the medication and notify the provider immediately? A. Blood pressure 168/102 millimeters mercury. B. Heart rate 118 beats per minute. C. Urine output 35 milliliters per hour. D. Fundus located 1 centimeter below the umbilicus. Answer. A. Blood pressure 168/102 millimeters mercury. Rationale. Methyl-ergonovine causes vasoconstriction and is contraindicated in hypertension or preeclampsia because it can precipitate hypertensive crisis or stroke. Question 4. A postpartum client begins to exhibit tachycardia, pallor, restlessness, and delayed capillary refill despite minimal visible vaginal bleeding. Which complication should the nurse suspect? A. Amniotic fluid embolism. B. Concealed postpartum hemorrhage. C. Pulmonary embolism. D. Disseminated intravascular coagulation. Answer. B. Concealed postpartum hemorrhage. Rationale. Postpartum hemorrhage can occur internally, e.g. hematoma or intra-abdominal bleeding. Early shock signs with minimal visible bleeding indicate concealed hemorrhage. Question 5. Which postpartum client has the highest risk for developing uterine atony leading to postpartum hemorrhage? A. A client with a precipitous labor. B. A client with prolonged oxytocin induction and polyhydramnios. C. A client with a 2.8 kilogram newborn. D. A client with a scheduled cesarean delivery. Answer. B. A client with prolonged oxytocin induction and polyhydramnios. Rationale. Uterine overdistension, polyhydramnios, and uterine muscle fatigue from prolonged induction increase the risk of uterine atony, the leading cause of postpartum hemorrhage. Question 6. A nurse is caring for a postpartum client experiencing heavy bleeding. Which uterotonic medication should not be administered to a client with asthma? A. Oxytocin. B. Misoprostol. C. Carboprost tromethamine. D. Methyl-ergonovine. The answer is C. Carboprost tromethamine. Carboprost is a prostaglandin F2 alpha that can cause bronchospasm, making it contraindicated in clients with asthma. Question 7. A postpartum client with severe hemorrhage becomes confused and her blood pressure drops to 84/50 millimeters mercury. Which intervention should the nurse initiate immediately while awaiting provider orders? A. Place the client in high Fowler's position. B. Start a second large bore IV line. C. Encourage oral fluids. D. Apply a warm compress to the abdomen. The answer is B. Start a second large bore IV line. Severe postpartum hemorrhage requires rapid fluid and blood replacement. Establishing 2 large bore IV lines ensures rapid administration of fluids and blood products. Question 8. A nurse assessing a postpartum client suspects uterine inversion. Which finding supports this diagnosis? A. Uterus palpable above the umbilicus. B. Severe pelvic pain with a mass protruding from the vagina. C. Moderate bleeding with a firm uterus. D. Gradual decrease in blood pressure over several hours. The answer is B. Severe pelvic pain with a mass protruding from the vagina. Uterine inversion involves the uterus turning inside out, often presenting with severe pain, hemorrhage, and a mass protruding through the vagina. Question 10. Which postpartum finding requires immediate intervention to prevent progression to postpartum hemorrhage? A. Boggy uterus located 3 centimeters above the umbilicus. B. Moderate lochia rubra during first hour postpartum. C. Mild uterine cramping during breastfeeding. D. Temperature 37.4 degrees Celsius, 99.3 degrees Fahrenheit. The answer is A. Boggy uterus located 3 centimeters above the umbilicus. A boggy and elevated uterus indicates uterine atony and possible bladder distension, both risk factors for postpartum hemorrhage. Question 10. A postpartum client develops a large vulvar hematoma following delivery. Which assessment finding indicates expanding hematoma requiring urgent intervention? A. Localized perineal discomfort. B. Severe unrelieved perineal pain with pressure sensation. C. Minimal swelling of the labia. D. Pink-tinged lochia. The answer is B. Severe unrelieved perineal pain with pressure sensation. Expanding hematomas cause intense pain and pressure, often disproportionate to visible bleeding, and require immediate evaluation.
Question 11. A client with postpartum hemorrhage has lost approximately 1,200 milliliters of blood. Which assessment finding indicates early hypovolemic shock? A. Decreased respiratory rate. B. Tachycardia and narrowed pulse pressure. C. Hypertension with bounding pulses. D. Bradycardia with warm skin. Answer: B. Tachycardia and narrowed pulse pressure. Rationale: early hypovolemic shock manifests as tachycardia and narrowing pulse pressure as the body attempts to maintain perfusion. Question 12. Which obstetric intervention during the 3rd stage of labor significantly reduces the risk of postpartum hemorrhage? A. Delayed cord clamping. B. Active management with prophylactic oxytocin. C. Immediate maternal ambulation. D. Routine episiotomy. Answer: B. Active management with prophylactic oxytocin. Rationale: administration of oxytocin immediately after delivery promotes uterine contraction and reduces postpartum hemorrhage risk. Question 13. A postpartum client continues to bleed despite oxytocin therapy. Which medication is typically administered next to control uterine atony if the client has no hypertension? A. Methyl ergonovine. B. magnesium sulfate, C. Bechamethasone, D. Terbutaline. Answer: A. Methyl-ergonovine. Rationale: methyl-ergonovine is commonly used after oxytocin to stimulate strong uterine contractions in cases of uterine atony. Question 14. Which laboratory finding in a postpartum hemorrhage patient indicates development of disseminated intravascular coagulation, DIC? A. Elevated platelet count. B. Decreased fibrinogen level. C. Increased hemoglobin level. D. Decreased PT and APTT. Answer: B. Decreased fibrinogen level. Rationale: DIC causes consumption of clotting factors, leading to decreased fibrinogen and platelets with prolonged clotting times. Question 15. Which postpartum client requires priority monitoring for delayed postpartum hemorrhage? A. Client discharged after uncomplicated vaginal delivery. B. Client with retained placental fragments. C. Client breastfeeding frequently. D. Client with mild perineal laceration. Answer: B. Client with retained placental fragments. Rationale: retained placental tissue prevents proper uterine contraction and can lead to secondary postpartum hemorrhage days or weeks later.
Question 16. A nurse performs fundal massage for a postpartum client experiencing uterine atony. Which finding indicates the intervention is effective? A. Increased vaginal bleeding. B. Fundus becomes firm and midline. C. Fundus rises above the umbilicus. D. Client reports severe pain. Answer: B. Fundus becomes firm and midline. Rationale: a firm, contracted uterus indicates successful correction of uterine atony. Question 17. A client with postpartum hemorrhage receives massive transfusion therapy. Which complication must the nurse monitor closely during transfusion? A. Hypercalcemia. B. Hypothermia. C. Hyperglycemia. D. Hypernatremia. Answer: B. Hypothermia. Rationale: rapid transfusion of blood products can cause hypothermia, worsening coagulopathy and bleeding. Question 18. Which obstetric condition is a significant predisposing factor for uterine inversion? A. Controlled cord traction before placental separation. B. Early breastfeeding. C. Spontaneous placental delivery. D. Delayed cord clamping. Answer: A. Controlled cord traction before placental separation. Rationale: premature traction on the umbilical cord before placental separation can pull the uterus inward, causing inversion. Question 19. Which intervention is commonly used when pharmacological treatment fails to control postpartum hemorrhage due to uterine atony? A. Uterine balloon tamponade. B. Cervical cerclage. C. Amniotomy. D. Vacuum extraction. Answer: A. Uterine balloon tamponade. Rationale: a balloon device, for example, Bakri balloon, is inserted into the uterus to apply pressure and control bleeding. Question 20. A postpartum client suddenly develops uncontrolled bleeding from IV sites and gums after severe hemorrhage. Which condition should the nurse suspect? A. HELP syndrome. B. Disseminated intravascular coagulation. C. Placental abruption. D. Uterine rupture. Answer: B. Disseminated intravascular coagulation. Rationale: DIC causes systemic bleeding from multiple sites due to depletion of clotting factors. Question 21. A nurse is caring for a client who delivered vaginally 2 hours ago. The client suddenly reports intense rectal pressure and severe perineal pain. The uterus is firm and midline, and only minimal vaginal bleeding is observed. Which complication should the nurse suspect? A. Retained placental fragments. B. Vulvar or vaginal hematoma. C. Uterine atony. D. Uterine rupture. Answer: B. Vulvar or vaginal hematoma. Rationale: a firm uterus with severe pain but minimal visible bleeding suggests bleeding into surrounding tissues, commonly a vaginal or vulvar hematoma. Question 22. A postpartum client is receiving oxytocin for uterine atony. The nurse notices the uterus remains boggy despite continuous infusion and fundal massage. Which action should the nurse anticipate next? A. Administer turbulin. B. Administer carboprost trimethamine. C. Encourage the client to ambulate. D. Apply warm compresses to the abdomen. Answer: B. Administer carboprost trimethamine. Rationale: if oxytocin fails, prostaglandins such as carboprost are administered to induce strong uterine contractions to control hemorrhage. Question 23. Which maternal condition during pregnancy significantly increases the risk of postpartum hemorrhage due to uterine overdistension? A. Oligohydramnios. B. Twin gestation. C. Gestational hypertension. D. Hyperemesis gravidarum. Answer: B. Twin gestation. Rationale: multiple gestation causes uterine overdistension, reducing the uterus's ability to contract effectively after delivery. Question 24. A nurse is caring for a postpartum client who continues to bleed despite uterotonic therapy. The healthcare team prepares for uterine balloon tamponade placement. What is the primary mechanism by which this intervention controls hemorrhage? A. Promotes uterine involution through hormone release. B. Compresses uterine blood vessels to reduce bleeding. C. Stimulates uterine contractions through nerve reflexes. D. Removes retained placental tissue. Answer: B. Compresses uterine blood vessels to reduce bleeding. Rationale: balloon tamponade works by applying direct pressure to uterine walls, compressing bleeding vessels. Question 25. A nurse is reviewing postpartum hemorrhage risk factors for several clients. Which client should the nurse identify as having the highest risk? A. Client with rapid labor lasting 2 hours. B. Client with prolonged labor lasting 24 hours. C. Client with epidural anesthesia. D. Client who delivered a 3.0 kilogram infant. Answer: B. Client with prolonged labor lasting 24 hours. Rationale: prolonged labor causes uterine muscle fatigue, increasing the likelihood of uterine atony. Question 26. A postpartum client with severe hemorrhage becomes increasingly tachycardic and anxious. Which laboratory value indicates worsening hypovolemia? A. Hemoglobin 13 grams per deciliter. B. Hematocrit 41%. C. Serum lactate elevated. D. Platelets 250,000 per millimeter cubed. Answer: C. Serum lactate elevated. Rationale: elevated serum lactate reflects tissue hypoxia and poor perfusion, indicating worsening shock. Question 27. A nurse is assisting during management of severe postpartum hemorrhage. Which medication is administered rectally to promote uterine contractions? A. Misoprostol. B. Oxytocin. C. Methylergonovine. D. Carboprost tromethamine. Answer: A. Misoprostol. Rationale: misoprostol, a prostaglandin E1 analog, can be administered rectally to stimulate uterine contractions. Question 28. A postpartum client with uterine atony continues bleeding despite medication therapy. The provider prepares for B-Lynch compression sutures. What is the primary purpose of this surgical intervention? A. Repair uterine rupture. B. Compress the uterus to control bleeding. C. Remove retained placenta. D. Prevent uterine inversion. Answer: B. Compress the uterus to control bleeding. Rationale: B-Lynch sutures mechanically compress the uterus, reducing bleeding when medications fail. Question 30. Which assessment finding in a postpartum client indicates early signs of compensated shock from hemorrhage? A. Hypotension and bradycardia. B. Tachycardia and cool clammy skin. C. Decreased respiratory rate. D. Warm flushed skin with bounding pulse. Answer: B. Tachycardia and cool clammy skin. Rationale: in early shock, the body compensates through vasoconstriction and tachycardia, causing cool clammy skin. Question 31. A postpartum client with severe hemorrhage is scheduled for an emergency hysterectomy after all conservative treatments fail. What is the primary indication for this intervention? A. Prevent postpartum infection. B. Stop life-threatening hemorrhage. C. Correct uterine prolapse. D. Treat postpartum depression. Answer: B. Stop life-threatening hemorrhage. Rationale: a hysterectomy is the last-line intervention used when uncontrolled postpartum hemorrhage threatens the client's life.
Question 31. A nurse is caring for a postpartum client 45 minutes after delivery. The client begins to bleed heavily and the uterus feels boggy despite fundal massage. The provider prescribes methylergonovine IM. Which assessment must the nurse perform before administering this medication? A. Assess the client's blood pressure. B. Assess fetal heart rate. C. Assess cervical dilation. D. Assess amniotic fluid color. Answer: A. Assess the client's blood pressure. Rationale: methylergonovine causes potent vasoconstriction and can trigger severe hypertension, stroke, or seizures in clients with elevated blood pressure. Blood pressure must be assessed prior to administration. Question 32. A postpartum client begins to show signs of severe hemorrhage. Which vital sign change is the earliest indicator of hypovolemic shock? A. Hypotension. B. Tachycardia. C. Decreased urine output. D. Altered level of consciousness. Answer: B. Tachycardia. Rationale: tachycardia is the earliest physiologic response to hypovolemia as the body attempts to maintain cardiac output. Question 33. A client delivered 24 hours ago and now presents with heavy vaginal bleeding, uterine tenderness, and subinvolution of the uterus. Which condition should the nurse suspect? A. Retained placental fragments. B. Amniotic fluid embolism. C. Pulmonary embolism. D. Placenta previa. Answer: A. Retained placental fragments. Rationale: retained placental tissue prevents normal uterine contraction and causes subinvolution and delayed postpartum hemorrhage. Question 34. During treatment of severe postpartum hemorrhage, the nurse anticipates the provider may order tranexamic acid. What is the primary purpose of this medication? A. Increase uterine contractions. B. Enhance platelet production.
C. Prevent fibrin breakdown. D. Replace clotting factors. Answer: C. Prevent fibrin breakdown. Rationale: tranexamic acid is an anti-fibrinolytic agent that stabilizes blood clots by preventing fibrin degradation. Question 35. A postpartum client develops postpartum hemorrhage after prolonged labor and magnesium sulfate therapy for preeclampsia. Which mechanism explains the increased bleeding risk? A. Magnesium sulfate causes platelet destruction. B. Magnesium sulfate relaxes uterine muscle. C. Magnesium sulfate decreases blood pressure. D. Magnesium sulfate increases fibrin degradation. Answer: B. Magnesium sulfate relaxes uterine muscle. Rationale: magnesium sulfate acts as a smooth muscle relaxant, which may reduce uterine contractility and predispose to uterine atony. Question 36. A nurse caring for a client with postpartum hemorrhage observes persistent bleeding despite uterine massage and medications. The provider suspects placenta accreta. What is the underlying pathology of this condition? A. Placenta prematurely separates from uterus. B. Placenta abnormally adheres to the uterine wall. C. Placenta blocks cervical opening. D. Placenta implants outside the uterus. Answer: B. Placenta abnormally adheres to the uterine wall. Rationale: placenta accreta occurs when the placenta invades too deeply into the uterine wall, preventing normal separation after delivery. Question 37. A postpartum client develops uncontrolled bleeding and laboratory results reveal prolonged PT, prolonged APTT, low fibrinogen, and thrombocytopenia. Which complication is most consistent with these findings? A. HELP syndrome. B. Disseminated intravascular coagulation. C. Septic shock. D. Amniotic fluid embolism. Answer: B. Disseminated intravascular coagulation. Rationale: DIC causes consumption of clotting factors, leading to prolonged clotting times and thrombocytopenia. Question 38. A nurse identifies postpartum hemorrhage caused by uterine atony. Which finding most strongly supports this diagnosis? A. Firm uterus with steady bleeding. B. Boggy uterus with excessive bleeding. C. Severe abdominal pain without bleeding. D. Minimal bleeding with firm uterus. Answer: B. Boggy uterus with excessive bleeding. Rationale: a boggy uterus indicates poor uterine contraction, the hallmark sign of uterine atony. Question 39. A nurse is assessing a postpartum client and suspects uterine rupture. Which finding would most strongly support this complication? A. Sudden cessation of contractions with abdominal pain. B. Mild vaginal spotting. C. Firm uterine fundus. D. Gradual uterine involution. Answer: A. Sudden cessation of contractions with abdominal pain. Rationale: uterine rupture often presents with sudden abdominal pain, loss of contractions, and signs of internal bleeding. Question 40. A postpartum client experiencing hemorrhage becomes pale, restless, and diaphoretic. Her blood pressure is 90/60 millimeters mercury, and pulse is 128 BPM. Which nursing intervention has the highest priority? A. Administer oral iron supplements. B. Begin rapid infusion of IV fluids. C. Encourage the client to breastfeed. D. Document blood loss. Answer: B. Begin rapid infusion of IV fluids. Rationale: rapid fluid resuscitation is critical to restore circulating volume and prevent progression to severe hypovolemic shock. Question 41. A nurse is caring for a client immediately after delivery. the placenta has not delivered after 30 minutes, and the client begins to experience heavy vaginal bleeding. Which condition should the nurse suspect as the primary cause of postpartum hemorrhage in this scenario? A. Retained placenta. B. Placenta previa. C. Amniotic fluid embolism. D. Uterine rupture. Answer. A. Retained placenta. Rationale. Failure of the placenta to deliver within 30 minutes after birth increases the risk of postpartum hemorrhage due to retained placental tissue, preventing uterine contraction. Question 42. A postpartum client develops severe hemorrhage shortly after delivery. The nurse notes the uterus is not palpable abdominally, and the client reports sudden severe pelvic pain. Which complication should the nurse suspect? A. Uterine inversion. B. Placenta accreta. C. Retained placental fragments. D. Cervical laceration. Answer. A. Uterine inversion. Rationale. In uterine inversion, the uterus collapses inward and may not be palpable abdominally, often accompanied by severe pain and hemorrhage. Question 43. A nurse is caring for a client with postpartum hemorrhage who begins bleeding from IV insertion sites and mucous membranes. Which complication is most likely occurring? A. Placenta accreta. B. Disseminated intravascular coagulation. C. Septic shock. D. HELP syndrome. Answer. B. Disseminated intravascular coagulation. Rationale. Bleeding from multiple sites, such as IV lines and mucous membranes, is a classic manifestation of DIC, where clotting factors are depleted. Question 44. A nurse is performing uterine massage on a postpartum client with uterine atony. Which action during this procedure is most appropriate? A. Apply continuous deep pressure directly downward. B. Support the lower uterine segment while massaging the fundus. C. Avoid palpating the uterus to prevent pain. D. Massage only when bleeding increases. Answer. B. Support the lower uterine segment while massaging the fundus. Rationale. Supporting the lower uterine segment prevents uterine inversion while performing fundal massage to stimulate contraction. Question 45. A postpartum client experiencing hemorrhage develops oliguria with urine output of 15 milliliters per hour. Which complication should the nurse suspect? A. Acute kidney injury due to hypovolemia. B. Urinary tract infection. C. Bladder distension. D. Preeclampsia. Answer. A. Acute kidney injury due to hypovolemia. Rationale. Severe blood loss reduces renal perfusion, which can lead to acute kidney injury and decreased urine output. Question 46. A postpartum client who experienced severe hemorrhage receives multiple blood transfusions. Which electrolyte imbalance should the nurse monitor closely? A. Hyperkalemia. B. Hypocalcemia. C. Hypermagnesemia. D. Hyponatremia. Answer. B. Hypocalcemia. Rationale. Citrate in stored blood binds calcium, potentially causing hypocalcemia during massive transfusion. Question 47. A nurse is caring for a postpartum client who delivered via cesarean birth and now develops abdominal distension, tachycardia, and decreasing blood pressure with minimal vaginal bleeding. Which complication should the nurse suspect? A. Internal hemorrhage. B. Uterine atony. C. Cervical laceration. D. Vulvar hematoma. Answer. A. Internal hemorrhage. Rationale. After cesarean birth, hemorrhage may occur internally in the abdomen, presenting with distension, tachycardia, and hypotension despite minimal vaginal bleeding. Question 48. A nurse is caring for a postpartum client receiving carboprost for uterine atony. Which adverse effect should the nurse anticipate? A. Severe constipation. B. Bronchospasm. C. Hypoglycemia. D. Urinary retention. Answer. B. Bronchospasm. Rationale. Carboprost may cause bronchospasm, which is why it is contraindicated in clients with asthma. Question 49. A nurse is monitoring for a client for secondary postpartum hemorrhage. During which time frame is this complication most likely to occur? A. Within the first hour after delivery. B. Within the first 24 hours after delivery. C. Between 24 hours and 6 weeks postpartum. D. After 8 weeks postpartum. Answer. C. Between 24 hours and 6 weeks postpartum. Rationale. Secondary postpartum hemorrhage occurs after the first 24 hours up to 6 weeks postpartum, often caused by retained placental tissue or infection. Question 50. A nurse is caring for a postpartum client with massive hemorrhage unresponsive to medications and uterine tamponade. The healthcare team prepares for uterine artery embolization. What is the primary goal of this procedure? A. Stimulate uterine contractions. B. Block blood flow to bleeding vessels. C. Removed retained placental tissue. D. Prevent uterine inversion. Answer. B. Block blood flow to bleeding vessels. Rationale. Uterine artery embolization occludes uterine blood vessels, reducing blood flow and controlling hemorrhage when other measures fail.
Thank you for watching. Postpartum hemorrhage is one of the most critical maternal emergencies you'll encounter on the NCLEX and in clinical practice. Mastering the warning signs, priority interventions, medications, fundal assessment, and fluid resuscitation strategies can make the difference between a correct exam answer and a missed life-threatening complication. Keep practicing these high-yield NCLEX questions until recognizing postpartum hemorrhage becomes second nature. If you found this video helpful, like this video, subscribe to MCQs Master 101, turn on notifications so you never miss a new NCLEX review. Share this video with your nursing classmates and colleagues. What topic would you like covered next? Let us know in the comments below. Remember, success on the NCLEX isn't about memorizing facts. It's about learning how to think like a nurse. Stay focused, stay consistent, and keep studying smart. See you in the next NCLEX review.